RightEye is something that brings to the practice an opportunity to look at brain health and functionality, whether it's for concussion or looking at developmental needs that kids or adults have in terms of tracking problems. And but more than that, it really speaks to the performance and the quality of life that people have from a visual standpoint.
RightEye is the only piece of technology that I have in my office where I can actually break that down for someone. I feel like I can communicate with the patient that if they have something that's happening that's weird and it doesn't make sense, it probably will make sense. So they tend to maybe open up a little bit more than they would when I start telling them some of my own symptoms.
So what I really like about RightEye is that it's a quick way to test patients for a lot of the visual skills that we know are important, and especially important when someone comes in and they've had some kind of brain injury, or when someone comes in and they're concerned about sports performance, or they want some type of baseline to see where they are down the road, both in terms of therapy or perhaps even if they were injured in a game. And what patients really like most about it is that when it's recording their eye movements and it's recording some of the other metrics of these tests that we do, they really like the fact that afterward we can go back and actually replay some of them so they can see exactly what their eyes were doing. And that's been a big hit.
When I saw RightEye last year, I immediately jumped on it. Just the wow factor of showing patients how they can use their eyes to manipulate a screen and what that can mean for them in their daily lives really appealed to me, and I thought it'd be something great to bring back to my patients. So I went ahead and jumped all in because technology to me is what separates us from what I think is going to be the old school of optometry, where there's so many competitors coming in just trying to do refractions that if you don't have services that differentiate you, if you don't have technology that can show people why they should be in your office and not the office down the street, you're going to lose out. That you definitely want to differentiate your practice from everybody else and from what might be online eye exams at some point. And to do that, you need to have services that they can't get anywhere else. You have to have patients that leave your office and talk about you and say, wow, I can't believe I had this in my optometrist's office. I've been getting my eyes checked for so many years at XYZ place, and I went to Dr. Claren, and he was able to show me how my eyes move through a paragraph, how my eyes move. And with that information, you can really make a difference.
The RightEye system has allowed me to get to the root of the problem, be more specific, much quicker and sooner than before. And that translates into the patient getting better faster, and allows me to make less errors and get right to exactly the type of plan or treatment approach that I need to have.